Meet Beryl. Beryl is a frail, elderly 89-year-old female living in a residential care community. Beryl moved to the community 2 years ago when she began suffering from dementia and was no longer safe living by herself at home. Beryl has been doing well, but today, staff observed Beryl undressing in the middle of the dining room. While this is a behavior Beryl has not demonstrated before, it is not an unusual behavior for someone with dementia. The staff were surprised by this new behavior in Beryl and moved quickly to maintain her dignity and assist her. Throughout this course, we will examine common behaviors associated with caring for persons with dementia and examine how to identify the meaning behind the behavior. According to the Alzheimer's Association, challenging behaviors associated with dementia often occur as a result of an unmet need or because the person is trying to communicate something. What could Beryl's undressing behavior mean? What could Beryl be trying to communicate to the facility staff? Could Beryl be removing her clothing because she's feeling hot? Perhaps Beryl thinks the male caregiver is her husband and wants to be intimate with him. What if Beryl is undressing because she needs to use the bathroom? Could it be that Beryl's clothing is uncomfortable, restrictive in some way, like her pants are too tight, or the tag in her sweater is causing her discomfort, so she wants to remove it? These questions illustrate how we can begin to think about Beryl's behavior differently, with the goal being to understand Beryl's behavioral cues and adjust our care and communication with her accordingly. More often than not, the person with dementia does not have the verbal ability to tell us what is bothering them, so we must pay close attention to nonverbal communication like facial expressions, body language, and behaviors to determine what the resident is trying to convey. So how common are these behaviors in someone with dementia? Beryl is much like the other 5.3 million Americans affected by Alzheimer's disease today. The majority of residents in assisted living have a diagnosis of some type of dementia, and over 90% of people with dementia will exhibit challenging behaviors at some point during the disease process, because dementia is so prevalent. If you're a professional working with seniors, it is likely that you will be in a situation where you will have to deal with inappropriate behaviors exhibited by someone with dementia.